Now, with the region seeing a huge rise in COVID-19 cases largely linked to the Omicron variant, we are seeing a record amount of infections reported daily. And with that, a rise in hospitalizations and deaths. Now this afternoon, Ballad Health reports 358 COVID-19 hospitalizations. That's up 9 patients in just the last 24 hours. 72 of those patients are now in the intensive care unit, 47 of which are on a ventilator. Niswonger Children's Hospital reports 9 pediatric COVID patients, an increase of 1 child from yesterday. Now, News Channel 11's Bianca Moret and Jeff Keeling looked at the data and asked the experts what they are now seeing in our local hospitals. Bianca joins us now live in studio. Bianca, what did you learn?
Well, Sydney, Ballad Health is reporting that over 80% of their COVID patients are now diagnosed with the Omicron variant, and that's something they've noticed over the last 2 to 3 weeks. We've heard nationwide reports that cases of the Omicron variant have been less severe and more mild than the Delta variant. So we asked Ballad Health what they've been seeing on the front lines. They said that they are still seeing patients getting very sick, needing ventilations, and even dying from the Omicron variant, especially those patients who are unvaccinated, much like the Delta variant.
We're seeing, as a percent, fewer people in the ICU, fewer people on ventilator, but still, if you're sick enough to be hospitalized in today's environment, you're a pretty sick person. So just because that you're not in the ICU doesn't mean that it's it's not a severe case, because it can be.
Ballad Health projections show that the Omicron variant's hospitalization surge could peak sometime next week, with those hospitalization counts rising over 400 in inpatients a day. They say they hope the surge begins to subside after that. About 35% of current deaths at Ballad hospitals are due to COVID. Now that's near the highest percentage yet. Now tonight at 6, I'll have more on what exactly frontline workers are seeing in our local hospitals as this variant continues to surge.